Okay, here we go. I'll show you how to administer the ceftriaxone that I take on a daily basis. First, what we're going to do is remove each and every one of our syringes from their packing. Create a pile here that we can dispose of at the end of the process. Okay, there we go. Next thing I want to do is remove my extension on my PICC line. Examine the area where the PICC line goes into my arm, the upper left arm, and of course that goes in through a vein and ends up just over my heart. The line is 48 centimeters from my heart out to the port where it comes out here. Before each and every process, we clean the port with an alcohol swab for approximately 15 seconds. And then what we'll do is we will remove the air from the injection, the syringe if you will. Remove the air, flush it, and then flush that through the line, starting first with a saline solution. And break the seal by pulling backwards on the syringe and then just gently forcing up, and that will remove any air bubbles. That simply screws onto the port, and we just flush it right on through. The saline flush, the initial saline flush, is to make sure that there is no debris in the line, to make sure that we have a good clean flow. Okay, that's done. Again, in between each and every step, we take an alcohol swab and we swab that port area to make sure that there is no bacteria that could possibly lead to an infection. We don't want that. All right. Next comes the medication itself, which is a solution of Ceftriaxone 2 grams in a sterile solution. We attach that to the port area, and this gets pushed over a period of approximately 3 minutes. I am noticing some improvement in my condition, although in the last day or two my conditions feel to worsen just a bit, which I'm told is normal by my care provider. You will typically feel an improvement on a graft situation that slightly increases, then it plateaus off and maybe even drops back a bit, and then it should have a steeper incline towards the end of the process, which is a 28-day period, or a month if you will. The last day or two I've noticed that my fingers, the dexterity in my fingers is reduced a little bit from what it was perhaps a week ago. And I'm very pleased with the process. It's been very straightforward. I've had very few glitches. My tachyderm, which is the coating that goes over the port entry or the line entry into my vein, it's come loose a little bit yesterday, but not enough for alarm. Still have a good tight seal that will prevent any moisture from getting into the area, to the site, thus allowing any bacteria to get in there that could lead to an infection. I have a sleeve that fits over my arm in order for me to take a shower. It's like a long shower cap, if you will, and it runs from my wrist all the way up to my my underarm, if you will. and it gives it a good, I won't say waterproof, but very water resistant. Keeps any water from hitting the bandage zone. Tomorrow will be, well, today is actually the 14th day. Started 2 weeks ago. Tomorrow will be 2 weeks ago on Monday that I began my treatments. That's when I went into the Harrisburg Hospital. They inserted the PICC line and gave me my first injection through an IV in my other arm. Okay, we're just about to get wrapped up with this. What we will do at that point is we will flush the line once again after, of course, cleaning the port. Then we will flush the line a second time with saline solution, and what that does is it pushes all the medication on through the line, make sure that we've got a good clean flow again, and the final step is that once again we will clean the port with the alcohol rub, and then we use an injection of what's called heparin. And it's a very mild blood thinner. It prevents any blood from clotting in the line. The PICC line itself also keeps the blood a little bit thin so that the medication circulates through my body a little bit easier. And the nurse explained it to me that the heparin is about the same intensity in terms of blood thinning properties as a baby aspirin, so it's certainly not anything that's very, very strong. Okay, go with the last saline flush. And our final step is, of course, the heparin. All of the syringes here, they're all clean. There is no blood involved with this, so they can simply go into your normal household waste. The trash container can be put by curbside and taken away by the sanitation department. An interesting name for garbage men, isn't it? Sanitation directors. Okay. I wish I had their job right now. Any job right now. All right. And ready to go with heparin. Again, this is a heparin in a sterile fluid. That's it. We're all done. What I'll do is wrap that line around again. I use this lock that is on the PICC line against the wishes of my nurse. But as I indicated to the nurse, that I have to unlock the line, because some people will call and say, well, I'm not getting a flush. I can't get anything to go through the line, and they find out that their lock was in place. Well, I have to unlock it in order to take the extension cord off. So that's a non-issue with me as far as I'm concerned. The lock is there for when they do draw blood once a week, and the lock is there so that when they remove that, the vial for the blood, they can push that lock in place and then no blood escapes out of the line until you get the saline flush back in there. Okay, that's it. Thanks for joining. We're going to clean up here real quick. As I say, all these things can go right into the trash container. And that's it. Start to finish. Thanks for joining.